This video will discuss bone reduction for guided smile in a natural case. Natural being delivering an FP1 prosthetic at surgery, which is the pink prosthetic here. Now, what we have done lately is we have designed the scallop guide, this gold color item here. This is metal. This is SLM metal, but we have designed this with a lingual aspect. Before it was just a labial aspect for contouring the gingival to try to even out the gingival. You can see here. Now, because of our request of our KOLs and the many doctors who've completed these cases, they really want a lingual aspect. And one of the reasons for this is to idealize the socket in an implant position. Let me turn on some implants here. So these are the trajectories of the multi-unit abutments, not necessarily the implants, but the multi-unit abutments. And what happens is in these surgeries, the scallop guide will not seat. And why doesn't it seat? Because it's going to have contact with either tissue. Let me turn on the tissue here, which is the lavender blue color. The scallop guide intrudes into the tissue. So on natural cases where there is bone reduction for ponic sites or opening up sockets, the palatal flap has to be laid. Otherwise, the scallop guide will obviously not seat. So that is critical to these cases because you don't want this to be a surprise. Now, we can design this other ways. We'd have to know that during the online meeting where you could just make a labial bow only, especially if there's limited to no bone reduction. We don't really need the lingual aspect, but this would be the standard design. So let me remove the tissue here and remove the patient, and then we have a socketed model. So this is what we do to prepare the case to fabricate chrome. We create a socketed model using segmentation. We remove the roots, right? Remove the teeth. Then we can tell when we are fabricating here in the laboratory where we need to adjust the bone in order for the socket guide to seat. You can see there's areas here where there's no gap between the scallop guide and the bone. And so when you receive the case, these areas, 1, 2, 3, there is a little bit of material here. Will be there's a gap there, sorry, but perhaps see here, right here, there's a little bit of adjustment. You'll see on the model we've marked in red where we have adjusted the bone, so that you can adjust the bone prior to trying to seat the scallop guide, or perhaps if you see where it's hanging up, then you can make an adjustment to it. So let's just turn the scallop guide off for a minute, because there's really two different tools to use. The other tool is using the CHROME prosthetic to indicate where the bone reduction is. So you can see that there is some overlap, encroachment of the prosthetic in the bony area here. Right. So this is where you would adjust, and you could passively, carefully seat this prosthetic. This will be the reinforced metal reinforced prosthetic, but these arms that extend down to the fixation base, they're just printed resin, so they have a little bit of strength to them, but you really want this to be passive. You do not want to force it or bend it. They will break, and that's, of course, trouble. You'd have to repair them. But you can see here, too, this is a this is actually an implant site right here. So by the time you drill out this osteotomy site, there may be enough bone already removed for the neck of this prosthetic, or if not, you would adjust the prosthetic. Now, if it has this type of thickness to it, you could adjust the prosthetic a little bit, but really the goal on natural is to adjust bone more than prosthetic, because you don't want to have a thin prosthetic any time during recovery, but you also don't want a thin prosthetic for the final restoration, because that will obviously lead to breakage, connector sites, that kind of thing, but prosthetic height. So scoop out this bone a little bit, adjust it until the prosthetic seats, leave a little bit for, tissue, right? You have prosthetic, bone, tissue in the middle. So use those two guides. Use the scallop guide and use the osteotomy to help you with the bone reduction. And of course, use the model that we have adjusted and marked in red. Here is an image of a natural case that was adjusted. Now this one there was a lot of bony defect here. This is not a normal outline of a bony structure for a natural case, but we did adjust these areas to make the prosthetic seat. And when you receive a bone model from us, now today is March 18th, so there may be some bone models that came out without being marked, but they should be marked in red, and that will indicate where to adjust the bone. And as always, please contact us with any questions on your particular case or on protocols.